So at SOHO this year, I'll be presenting on behalf of all the co-authors on the CARTITUDE-1 study, a more detailed look at patients who are able to achieve MRD negativity on the CARTITUDE-1 study. So we already know from the published results that on the study, patients who received cilta-cel were, in general, able to achieve a deep response. Overall, they were close to 82% of the patients who had stringent CR. We also know among those patients, we had 61 patients who were evaluable for bone marrow MRD status. So now we have data from more than 28 months of follow-up for those patients. So we can see that for patients who are able to achieve MRD negativity in the bone marrow, and especially sustained MRD negativity, which was defined as 2 consecutive MRD negativities that are at least 6 months apart, no interim MRD positive results before the patients had documented progression or went on to subsequent treatments. And we saw that on the study for patients who are able to achieve this sustained MRD negativity for at least 6 months or longer. We have data for patients who also achieved 1 year or longer. But these were the patients who had the deepest response. 100% of those patients had stringent CR, compared to patients who didn't have this sustained MRD negativity for at least 6 months. Only half of those patients achieved stringent CR. And so not surprisingly, we also saw that patients who had the sustained MRD negativity for at least 6 months or longer are the ones who had the longer duration of response and PFS. Overall, when we look at the patient baseline characteristics before they went on to get CAR-T, there were really nothing that were statistically significantly different. So nothing to predict who might be able to achieve and have this sustained MRD negativity. There was a trend towards patients who may have had a longer time since diagnosis before coming on to CAR-T, or patients who may have less percent of patients who may have had plasmacytomas, but nothing that really achieves statistical significance. So I think this speaks to the importance of how do we monitor these patients after CAR-T therapy so that we get the most benefit out of that treatment.